Every 40 seconds in the U.S., someone has a stroke. One of those people was Prince Quire, who lives in metropolitan Atlanta.
I go to work in the evening, so prior to work I usually go about an hour at the gym before I go to work. And all of a sudden, I just felt dizzy. And I started holding on to the wall, holding on to my friends. He said, lift your left hands, and I barely could move my left hands. So they called 911 immediately.
When the ambulance arrived, the EMTs assessed Prince for signs and symptoms of stroke. At only 39 years old, he was younger than the typical stroke patient, but EMTs know that a stroke can happen at any age.
And I remember the paramedics coming by and they said, they ain't able to save this guy, we have to airlift him immediately to Grady Hospital.
Fortunately for Prince Quire, Grady participates in the Paul Coverdell National Acute Stroke Program, implemented by the Centers for Disease Control and Prevention. The program tracks and measures acute stroke care in order to improve the quality of care, from first contact with emergency medical services to the hospital and after the patient returns home from the hospital. The program works to improve stroke care nationwide and reduce stroke complications and deaths, particularly among those with the highest burden. The Georgia Coverdell Stroke Registry started at Grady in 2001 with CDC funding to Emory University. Today, the program is embedded in Georgia's public health mission. For Grady Hospital, participating in the Coverdell Stroke Program has paid off in results.
I think Coverdell has been integral really with changing the measures that we actually implement for our stroke patients. They have not only given us education as stroke coordinators, but helped us to develop a statewide EMS protocol.
Stroke is the 5th leading cause of death in the United States and a major cause of severe disability. Yet up to half of all stroke patients don't call 911 or use emergency medical services to get to the hospital, even though doing so results in faster treatment and a better outcome. The Coverdell program is working to solve this problem by strengthening partnerships between EMS and hospitals to provide care sooner to patients. Hospitals and stroke centers across the nation can use these same strategies to improve patient care and help save lives.
Reducing the amount of time from when a patient arrives to the emergency room to when they get a CT scan, when their blood work is done, when the medication is delivered, makes a huge difference in terms of how people do. But hospitals didn't really know how to focus on these processes and improve that level of care. The Coverdell program was really about 2 things, and has been since its inception nearly 15 years ago. It's about collecting data about patients and their care and using that data to drive the process of improvement, which means shortening those times to the CT scanner and shortening those times to treatment. The Coverdell program has quite literally saved lives. The data that we have shows that mortality or death rates are less from stroke in the communities around hospitals that provide this type of care.
I would absolutely encourage people to be involved in Coverdell and in stroke care, because these patients are so vulnerable. So to be able to help these patients is an incredible journey, really. And it does take so many people to make this happen.
We're trying to prevent strokes, we are trying to recognize strokes early, and then we're trying to streamline the care that people receive in order to improve the outcomes that they have, improve their quality of life, reduce their long-term disability. Coverdell has worked with states to improve stroke care. This accounts for over 550 hospitals across the nation, and that means that more than 530,000 stroke patients have received care at these hospitals, have received their acute stroke care, and have really benefited from the quality improvement activities that Coverdell has implemented. And the data shows it's working. We're thrilled, yeah.
But for Prince Quire, what matters most is that he can continue to live life to the fullest, thanks to the excellent care he received and Grady's participation in the Paul Coverdell National Acute Stroke Program.
I want to be a spokesperson for this, to be honest with you. Just like I got saved, I want to save other people. I think what motivates me the most is my 4 kids. I want to be able to see them grow up, go to college, have their own family, and me passing down this, eating right and healthy lifestyle, and they're passing that on to their kids.
you.